with Bozeman Health. And I think we were going to have somebody from MSU, but I don't think that they had. Oh, there you are, Mike. Sorry, I was looking at the wrong Hollywood Square there. Michael Becker is here from MSU. I'm going to start by walking you through our weekly surveillance report. Then we'll just throw it open to a couple comments if Kallie or Mike have that, and then we'll throw it open to questions. Okay, so you can see the plateau that we've been on. We've seen some decrease in the number of cases per 100,000. That's good since last week, but just overall, looking back to February 1, we continue to see that we're somewhat stuck on this plateau between 20 and 30 cases per 100,000 per day. Really would like to see that continue to come down in the days and weeks ahead. That said, we continue to see relatively low hospitalizations, which is good. We're at single digits in the number of people who are in the hospital with COVID. I think that was at 7 this morning, something like that. So that's good. That's promising. Our positivity rate overall is down below 5% this week, the rolling 7-day average, to about 4.6%. That's down a bit from being just above 5% last week. I don't have the number without Big Sky factored in, although I don't think it's going to be that much different. I would imagine it'll be a couple points above that. We'll get that number. That's why I was a little bit late getting to you today. We'll get that number if you're interested in it. But generally, again, we're still on that plateau with positivity rate 2. That's in a little bit more optimal spot related to overall positivity being below 5%. We want to keep it there. We're getting tests back with relative dispatch. We have a number of days where the turnaround time is the median turnaround time is a day. It looks like the overall median time from specimen collection to report to public health was at a day for the past reporting period, or for the past month. That's great. That's what we want. It allows us to get the cases faster. I know we're all focused on the vaccine. We're still doing contact tracing to reduce the number of cases that we have in the community. The number of days from specimen collection to date received by public health, again, that's looking pretty good. We're getting contact tracing started really quickly when we get those reports. And you can see the onset date of the cases we have, again, kind of on that same like plateau where we've been in the past. I think it's important that when you look at this big peak and you look at us from relative to this big peak, it looks pretty good. But when you're really looking at this, we're kind of looking, we're plateauing at the peak where we were last summer. And so it's still a pretty high base to start from. And we'd really like to see those numbers come down, and really need help from people to continue that social distancing, continue wearing face coverings, continue washing their hands, staying home when they're sick, and just acting overall like could be spreading the disease, because you could be, even if you feel perfectly fine. The age category, this is, continues. We continue to see younger age categories, particularly people in their 20s, are, the most commonly diagnosed group. And you can see that has picked up again since the beginning of January. Continues to be a significant driver of our local outbreak. MSU, the number of active cases is down by about 30% compared to where we were last week. And they had about 21 cases at MSU. This is very somewhat similar to what we're seeing in the community overall. And we are seeing, a significant number of cases in K-12 schools, both among students and staff, and we're working through those. We're working at our long-term care facilities. Let me look real quick here. So I think it's important. I'll have to find that later. We've done a pretty decent job keeping cases out of long-term care facilities. Those numbers, we still have some cases, but they tend to be fairly low. We did our largest ever point of dispensing at the fairgrounds yesterday. We did over 1,100 doses, first doses at the fairgrounds. That went well. It was quite an operation, but we got those vaccines out. We did somewhere north of 500 on Tuesday, and we're back at it again today. Continuing, I think we have a pod in conjunction with community health partners today. We're going to continue working in that vein. With that, I'll throw it to Kallie. She can give you an update on where Bozeman Health is.
Sure, thanks, Matt. I have a really short update for today, and I'm happy to answer any questions. This week, we've held one first dose clinic at Deaconess Hospital, and on Sunday, we are hosting our first clinic at Ophir School in in Big Sky, through our Big Sky Medical Center. We have another first dose clinic at Deaconess Hospital next week, and we continue to contact patients as we have vaccine available and are looking at other contact methods to help assure patients that they are on our list, reaching out to more individuals to assure them that they are on our list. We're moving into phase 1B+ on Monday, and our teams are working to identify those additional patients so that we can appropriately contact them as well. A quick update on how many doses we've administered. To date, we've administered over 10,500 doses total. 6,500 of those are first doses, and those are to people who are eligible within phase 1A and 1B. Moving into bed capacity, currently at Deaconess Hospital, we have 80% of our critical care beds occupied, with 87% of our non-critical care beds occupied. And that is all of the update that I have for today. Thanks.
Thanks, Kallie. Mr. Becker?
I don't have any specific updates from MSU today, but I'm happy to answer questions.
The other thing I think we should say is we're continuing to reach out to other partners as different sources of vaccine become available, different brands. We're reaching out to some of our pharmacy partners, other organizations in town to create more front doors to the vaccine. And I know there's some federal allocations that are going to be hitting some of our local pharmacies in the days and weeks ahead. And trying to stay in touch with them, although those doses do not go through the health department, don't go through the state. We're trying to stay somewhat coordinated with them, although they have a slightly different system for prioritizing who's eligible for those shots. And I can answer questions for that if people are interested. So with that, I'll throw it open to questions.
Hey Matt, it's Perrin from the Chronicle. I wanted to ask you about that federal allocation versus what you all get from the state. Do you have a sense of which pharmacies are in that federal program and what their eligibility is compared to what you and Bozeman Health and CHP and MSU are doing?
We don't have a comprehensive sense, Perrin, and I want to be careful about mentioning any specifics and kind of creating a rush to those entities. It's the organizations that I'm sure you would be calling. We're kind of doing the same thing. We're reaching out, we're having those conversations. We've had conversations with a number of them and trying to understand where they are, how we can support them. And as we get information from them, we'll be putting that out through Whitney and through our website, so people have that information. But it's really kind of in the formative processes right now.
Afternoon, Matt. I wanted to jump in and ask you probably one of the big ones that are on our list, but we had that pretty comprehensive press release yesterday on the variants. Just wanted to ask you about that and going into that a little bit that we've seen here in Gallatin County.
Yeah, thanks for the question. So, we had the variants that we identified. We shouldn't be that surprised by that. We've detected what's known as the UK variant, and I think over 45 other states, or at least 45 other states right now. So it shouldn't be a shock that it's in Montana. I think one of the reasons that we were able to identify this is there a little bit more testing going on in Gallatin County related to MSU, because of some of the lab capacity we have at MSU. My understanding is that this variant, what people need to know about it, it's associated with it seems to spread more readily, and that is a concern, because if you have it spreading more readily, you're more likely to get more cases. And as I've said before, this is a numbers game. When you have more cases, you have more chances of people ending up in the hospital. You have more chances for somebody getting serious illness and driving mortality. There are some initial studies indicating that there may be associated with an increased risk of death with this variant virus. But the CDC website and the resources we're saying is we just don't know yet. We need more data, more studies are needed to confirm that. We're in a situation with these variants very similar to where we were a year ago with the virus itself, the underlying virus, and that we're learning more about it. That's going to change. People need to be open to what we're learning and how that changes. And in the meantime, the good news is the things that we've been doing to protect ourselves and protect those around us still hold. That social distancing, that physical distancing between yourself and others, staying out of large groups, wearing face coverings when you can't socially distance, or when you're out in public, especially indoors, washing your hands on a regular basis, staying home when you're sick, being sensitive to those around you, really thinking about when you're going to be near people who tend to be in sensitive groups, being extra careful when that's happening. So it shouldn't be surprising. It shouldn't be something that causes panic, but it should be sobering. It should be a reminder to all of us that while we should all be really thankful that we have access to these vaccines. We should be thankful that our case numbers are below where they were in the fall. There are still some risks and threats out there, and we're not done with this yet. We need people to continue to be safe, continue to wear face coverings, get the vaccine when it's available. And I think if we do those things, we have the best chance of getting back toward normal sometime this summer.
And going into that was because that press release was just at home in a lot of different categories and was very detailed. But just to kind of reiterate, no connection to each other, no recent travel. What does that tell you again?
Well, whenever you have a number of cases, you look for connections to see if one person spread it to other people. And the fact that we're not seeing those connections, is an indication that's it's not 3 cases from a single cluster or 2 cases from a single cluster, that these, appear to be 3 different people who acquired this virus, probably in different circumstances, which tells us that we probably have it in the community, and it's probably spreading fairly widely, at least in Gallatin County, if not the entire state. Again, we should not be shocked by that. This variant has been in the United States since late in 2020. We know it's been in other states. We know how much travel goes on between the states. So it's something that we're not surprised by.
Gotcha. I think I'm good for now. I might have another one bubbling up here, but it'll take me a bit.
I had 2 questions about surveillance and then also the Johnson & Johnson vaccine. With surveillance, are like a subset of specimens being tested for the variant, or I'm interested in how that works. And then with the Johnson & Johnson vaccine, since it is a single shot vaccine, is a certain demographic being targeted, somebody who maybe can't get to a clinic more easily, or how is that going to all work?
Yeah, so the first one is really a good question for the state. I know that the state sends a specific number of specimens to the CDC or to CDC reference labs on a regular basis. How they do that and to what extent they're doing that is really a question that I would defer to the state. It's not something that we're doing at the local level. We've got our hands full with a lot of other things, but in talking to the DPHHS, even before these variants were detected, I was aware that they were doing that. On the second question you had, the Johnson & Johnson vaccine, it's not that we're targeting any specific demographic group, but what the Johnson & Johnson vaccine allows us to do is open up more front doors for the vaccine for more people. Because of the storage requirements and because it's a single dose vaccine, it's easier to administer, it's easier to take care of, it's easier to put it in a refrigerator at a clinic and be able to give shots one by one as people come through clinic. And so that really opens up some doors. Pfizer is much more time intensive. The storage requirements are more complex. There's some work that has to be done when you're administering it to prepare the vaccine, and it's more complex, and it's just not something that's super practical for a lot of smaller clinics where people are coming in small numbers. You really, with the Pfizer vaccine, you want to see those large numbers of people so you can get that vaccine administered all in one shot and not waste any. And we've been successful doing that. Johnson & Johnson changes the game with that. It really is something that can be stored for longer periods of time at much higher temperatures and in a refrigerator essentially. And so we're really looking to share that vaccine with those providers who are not maybe equipped to do those large pods, but can help us get vaccine out in the smaller numbers. And so that's kind of how we're using the Johnson & Johnson vaccine, reaching out to some providers and sharing it that way.
Hey, Matt, it's Noah Schmick with ABC Fox Montana. How has mask wearing been specifically in businesses in the county, and have complaints increased to the health department since the governor repealed the statewide mandate?
I don't know that complaints have increased. We've always gotten our share of complaints before and after. It depends where you go, Noah. I mean, we shouldn't pretend that everybody's wearing masks everywhere you go. I think the important thing about having the mandate here in Gallatin County is it gives business owners, it gives government leaders, it gives others a foundation, something to hang on to when they're putting that sign up in the window, when they're interacting with customers. They can reference that mandate and say, this is something we're doing because the community, the Board of Health, and the community has decided it's important. It makes it so that we stand behind them when they're making those decisions. When you don't have that, you kind of tend to leave business owners out there on their own having those conversations with people, and that's harder. So I think we do see it is really important in my mind to be able to open up more places for people to go where they feel safe, where there is mask wearing and going on. We're not pretending that there's 100% compliance 100% of the time, but I think the mandate does create the spaces that are really important for people who are seniors, people who have underlying health conditions, to be able to go to the grocery store, to be able to go into government offices, to be able to do those things that are necessary to live your life. But you shouldn't have to take your life in your hands every time you walk into those places. And so wearing a mask, we've had, over 1,300 deaths in Montana. That compares to, roughly 200 and some, 220, 250 highway traffic deaths. Think about all the rules that we put in place to save lives on highways. There's speed limit laws. There's everyone has to take a test before they drive. There's a lot of rules that we have to protect the public from other drivers, drunk driving laws, those sorts of things. We do that all the time. We take that for granted. We're really talking about the same thing with these masks. You put on a mask, you can really cut transmission. You can really protect the people around you. You can really, and it's in a period of time when we're losing thousands of people a day to this disease. It's a pretty small price to pay to be able to protect those around us.
Hey,
question?
Matt.
Go ahead.
Yeah, Matt. This is Seaborn Larson from the Helena Independent Record. I'm wondering about, once the variant was identified, how did that information kind of move between the county and the state agencies involved, and what went into the decision on how that information was released to the public?
Well, we were notified a week or two ago that there was some specimens that were of interest for the some testing that was going on at MSU. Those were sent out to a lab that is validated by the Centers for Disease Control to actually determine whether or not those are variant strains of the virus. We've had, my understanding from the state is we've had suspect specimens before that turned out not to be variant strains of the virus. Those were sent out to the testing lab, and I think that was Tuesday. Those results came back, and we started notifying the public and talking about it. That's how that worked. I think that the state's been regularly sending out specimens to the CDC. These actually were specimens that were sort of pointed at by some researchers at MSU as something of interest. Then the state wanted to make sure that those were valid, and they went to a lab to be validated. I think the lab was in Wyoming. The questions?
Thank you.
Yeah.
Seaborn, I think, sorry, no, I didn't mean to interrupt you. I think too, when it's something like this, where the state is doing the testing, we definitely on our end coordinate with them on communications. So there was some coordination. We wanted to follow the state's communications. When we knew that they had released some information, then we released our information on the tails of that. So that was how that worked. If that a little bit more specifically to your question.
Yeah, thank you, Whitney.
Noah, did you have a question?
Yeah, I had a question though for Mr. Becker. I was wondering if he had any updated numbers for us on vaccination of medical students, staff, and faculty.
No, we all told, I believe, have vaccinated our latest vaccine push with students produced about 600 eligible students vaccinated under the 1B and then retroactively under the 1A guidelines. And I believe in total MSU has vaccinated north of 800 from our campus community.
Perfect, thank you.
Matt, I had a follow-up question for kind of what you were talking about when Rachel and Seaborn asked questions. How does the MSU testing for variants fit into what DPHHS and the CDC are doing?
You're on mute, Matt.
Thank you. So it'd be a good question for DPHHS, Perrin, how they fit into the DPHHS system. But my understanding is that there's a number of specimens being tested at MSU PCR testing. They have a contract with the state. They run that PCR testing. My understanding is some of the researchers did some genetic sequencing on a few of the specimens, identified them as worthy of additional study, and then they were packaged up and sent out to a CDC reference lab that is validated to actually say whether or not they're really the variant strain or not. Other questions?
This is Iris from the Associated Press, and I have another question regarding the variant for you, Matt. I'm wondering if you know, and this may be a question better directed at the health department, but do you know if there's going to be additional testing of specimens for the variant now that we know that it's present in both in Gallatin County and in other parts of the state?
Again, that we have our hands full with vaccine distribution and contact tracing, and I'm leaving the search for variant strains to the state and to the CDC. So those questions really need to go to them. I would imagine that there are plans to continue looking for it, but I don't want to speak to the details of that because that's really stuff that's happening at the state health department and with the CDC.
Okay, thank you.
Yeah, you're welcome. Other questions?
Hey, Matt, this is Emma with NBC Montana.
Hi, Emma.
I was wondering if you knew of any possible plans or any partnerships possibly with pharmacies to vaccinate teachers similar to what's being done in Missoula County.
Yeah, so we're reaching out to those pharmacies to find out what their plans are. As you know, the federal allocations come with a different set of parameters in terms of who can be vaccinated. We'll be fully supportive of those pharmacies as they reach out to schools and get those shots going if they do that. I would suspect that will be happening, and we're already starting to coordinate to understand when and where that might happen. I'm open to that, and I'm sure that we'll see some of those providers be doing that in the weeks ahead.
Hey, Matt.
Thank you.
Hey, Patrick.
This is Patrick Lonergan. So literally 10 minutes ago, we got notified by OSCO, and this would specifically be the OSCO pharmacy at the Albertsons in Bozeman, that they are expecting a federal shipment next week, and they do intend those to be focused on teachers.
Great. Thank you, Patrick.
Other questions?
Sorry, Matt, Rachel Kramer, Yellowstone Public Radio again. When you were talking about the Johnson & Johnson vaccine and reaching out to some providers, have you received any news about how many of those vaccines the county will receive? And can you explain a little bit more about what you meant by reaching out to some providers to, I assume, share the vaccines with them? Or
yeah, so different organizations are registered with the state to be a vaccine provider. We are coordinating the state we're talking about the state allocations now. The federal allocations are kind of a different beast that we don't have as much involvement in and as much say over. But those state allocations that we coordinate with Bozeman Health, Community Health Partners, and MSU on, we're reaching out to other providers who are registered to be vaccine administrators with the state to determine their level of interest in getting those vaccines, because we want to share. We want that if they're registered with the state, we want to create as many front doors as we can. So like an urgent care would be one example of a situation where you could share the Johnson & Johnson vaccine. They could keep it in the fridge, and it's a little bit easier lift for them to administer. And so that's what I meant by that. And we'll be reaching out to really anyone who's registered with the state, in other words, been approved by the state to handle the vaccine, to be part of our effort, because we need all the help we can get. What was the second part of your question? Or was there?
I guess I was well, just because Governor Gianforte was saying 8,700.
Oh yeah.
And so, yeah.
So last week I think we were notified that we were going to get an initial batch of 800 doses. I think we've got, and we're sending those out. I don't know that we've gotten news of any additional batches, although we're expecting to hear that we will. That was, I think we knew that last week when we talked, that we were getting those 800 doses. So that's not new information, but we are getting, and Patrick's popping out again, so he might have something to say.
No, you're correct, Matt. We've received an allocation of 800 and been told not to expect another batch of the Janssen, aka Johnson & Johnson, until towards the end of the month.
Other questions out there?
I guess my last one for you, Matt, and I think they've bubbled this one up enough to make it sound, make sense. But next week with Phase 1B Plus, and we've talked with a few different folks who are not sure exactly what to expect in terms of clinics. Just kind of looking ahead to next week, And you may have mentioned this throughout, but he was talking to me. What are we kind of looking to expect next week for phase 1B plus in terms of clinics and so forth, just with the county?
I mean, speaking from the county level and the clinics we're running at the fairgrounds, the clinics won't look any different. The systems that we're using to have people sign up really won't look that much different. The main difference is that people between 60 and 69 will be eligible for the vaccine and will be able to sign up for it. I know that the other thing that I want people to understand is that we're going to continue to do really aggressive and expansive outreach to people who are 70 and up. We haven't gotten to all those folks, and I want to acknowledge that, and I want to make sure that the people in that age group understand. While we're going to follow the state's lead in moving through the phases, we understand that we are not done vaccinating people who are over the age of 70. And we're going to continue to focus our resources and our energies on identifying those folks and getting them into the clinics and finding the ways to create new front doors for them. That can be a challenging group to reach. Sometimes there's technology issues, sometimes there's transportation issues. We're not letting up on that one bit. We understand that group is out there. But really what it changes is it allows people who are 10 years younger to be able to sign up. And we expect that'll start happening next week.
And Cody, next week, it doesn't change the clinics we have scheduled next week. There are 2 clinics that are for second doses. And then we anticipate that we should be able to do another first dose clinic and have some public signups for the week after, but we haven't confirmed that yet. We'll wait to see what our vaccine allocation is, but that's our hope, is to then open it again. But yeah, next week 1B doesn't change what we have scheduled, at least for the immediate future, for our 2 clinics next week, which are just second doses.
Kelly, did you have anything you wanted to add to that?
No, I think you stated that well, Matt. We recognize that there are still patients who are in the current 1B phase, and we will continue to prioritize them. Also acknowledging that there may be space for the 1B plus as well. So we'll start to fold them in and incorporate them in our clinics. We do have a first dose clinic coming up next week. So we'll be working on making sure that those who haven't received their vaccine within 1B continue to be prioritized, and then adding in the phase 1B plus as well.
I think the one thing you all could help us with is the understanding now with those federal allocations coming to some providers. Specifically, I think some of the pharmacies and some of the retail outlets, they get those federal allocations. The federal government is asking them to vaccinate teachers, and we're supportive of that. But I think it's also important to understand that not everybody who has vaccine has the ability to do that. The state is asking us not to do that, to continue to focus on people 60 and older. We're gonna honor that with the state allocation, but we're gonna support those entities out there that are getting the federal allocation to fulfill the demands of those allocations, which includes teachers and work. So you might end up, there will be some confusion. People are going to call, I'm sure they're going to call us, I'm sure they'll call a hospital because they're teachers. You have to have that federally allocated vaccine at this point in time in Montana to be able to administer that vaccine to teachers and early care workers. As that develops, as we understand where that's going to happen, we'll be sharing that information in a more proactive way. But that's really developing kind of on the fly right now, and it doesn't move through the state. It doesn't move through local health departments the way that the state allocation does. Perrin, did you have a question?
Yeah, sorry I interrupted you. I just wanted to ask why you guys chose to move into this 1B plus, recognizing that the majority of people in 1B haven't yet been vaccinated.
A lot of it had to do with our experience with 1B at the beginning. When we tried to really focus on upper age levels, and you remember when we first started this, we were really looking at people 80 and above. it really became very difficult logistically from a communication standpoint to be on a different plane than where the state is. When the state moves to a different phase, it's very difficult for the local health departments to maintain anything different. Some will, but I'll tell you our experience with that at the beginning of phase 1B it caused confusion, it caused frustration, and frankly, the whole point of this is to get shots in arms. And so we're trying to simplify it rather than trying to explain two messages. We're going to go with the state message. We're going to do what we can, but we're going to do everything we can to continue to reach out to people who are 70 and older, and probably make access as easy for that group as we can. But it no matter what we do, if we kept it 70 and older, the people who are 60 to 69 would be calling us and asking us, why are you not honoring the state system? If we're doing it this way, I understand people who are in their 70s are saying we've been waiting and now you're still opening it up. I get it. It's frustrating. I do think there's more vaccine coming. We're going to continue to open doors, and people need to understand that just because we're changing the phase or moving to another phase does not mean we stop giving vaccine to the previous phases. In fact, it's just the opposite. Other questions? You guys got a lot of questions today.
I have a couple questions, and I hope you don't mind. They're kind of more high level. So if it's more appropriate to do it later offline, let me know. It's been a year now, so I've kind of been reflecting on the last year, and that in mind, I was wondering how it's been as a health officer to make decisions to essentially protect the health of the community while at the same time you're kind of learning about this virus at the same time that we are. Difficult.
It's been pretty hard. And I think that goes from, Dr. Fauci all the way on down to lowly guys like me trying to do it where the rubber meets the road. It's been challenging. Science is about learning. It's about being flexible, being open to new ideas, adjusting to the new reality. We've been doing that in a political environment, in a cultural environment that sometimes wasn't super friendly to that free exchange of ideas and really finding our way in a new frontier. None of us had been through a pandemic like this before. None of us had seen this virus. That was really tough, and that has been really tough. I will say, as hard as it's been, I'm just can't be more proud of the team that we've been working with, the health department, at the Department of Emergency Services, Bozeman Fire Department, Fort Ellis Fire Department, Hebgen Basin Fire District, Big Sky, you name it. The city of Bozeman, the city of Belgrade, the work that's been done by the community kind of banding together to do this has been humbling, and I'll be forever grateful for it. So there's been really, you go through intense situations like this. There's challenging things. I'm trying not to focus on those things. I'm trying to remember that we've got quite a community, and we're really working hard to serve the people that we serve. So it's been hard, but I think it's also been pretty rewarding in a lot of ways.
Perfect. I'd be interested to see, Kallie, if you have an answer as well.
Yeah, I get asked often about that, and it was the learning opportunity of a lifetime, and we are going to be taking many COVID legacies into the future with us. I don't have all of those summarized at this point in time, but how to build relationships and change things at the pace that we did was phenomenal. Working with a large, complex system and shutting down operations and communicating to a very large patient population was, like I said, the experience of a lifetime. And there's a lot that we'll learn from that.
And just one more, Matt, what would you tell the community still lies ahead, and how can we arm ourselves for it?
Matt, you're muted.
I want to make sure I'm
Dead
being
silence.
respectful to Kallie, and then I forget. We have a ways to go. We're not at the end of this yet, and we have some work to do together to protect each other while we get the vaccine distributed. We have some things to look forward to and some reasons for hope. The fact that we have 3 vaccines, the fact that those are being administered at a pretty significant clip and it's expanding. We also have some vulnerabilities. These variant strains of the virus are concerning. And so it's really important that as we work to get these vaccines distributed, everybody continues to do their part to slow down transmission. We are not done with this yet. And if we can bear down this winter and into the spring and slow down transmission while we continue to give those vaccines, that's our best hope for a more normal summer, for a summer when we get things loosen up and we can enjoy each other and being close to one another again. But we need to continue to bear down. We're not there yet. We don't know how these variant strains are going to spread. We've seen some lessons to what's happened in one of the variant strains in Brazil, what's happened in the UK, and some other places. We could still have another surge. In order to prevent that, we need people to continue to be careful, continue to socially distance, continue to wear those face coverings, and get vaccinated when they have the opportunity. It's going to be important. At some point in time, we're going to get to the people who really want the vaccine, and it's going to be more about trying to communicate with the people who aren't sure or who just haven't taken the trouble yet. And that'll be a different challenge. So we want people to be comfortable with the vaccine and get the vaccine when it's available, and be careful until we get to a point where we can feel like we're not at risk of having a surge happen.
Thank you. That's all.
Anybody else? All right. You all have a good weekend. Have a good rest of your Friday, and take care.
You got her, Matt. Thank you all very much.